Hello, I'm Jackie Brunton, the lead nurse for Cancer and End of Life here at the Trust. We've introduced video calling to allow loved ones to have conversations with patients whilst they're in our care. This video will give you the information you need to get started. Full training is available via e-class, so if you ask your ward manager to arrange it for you. To arrange a video call, agree a convenient time with the family and provide them with the instructions on how to access the waiting area. They will access the patient and relative communication waiting area via www.bfwh.nhs.uk, and when prompted, they will enter the patient's name and date of birth. This will help you to identify which patient they are visiting. When it's time for the appointment, using the ward PC with webcam and headset, log in to attend anywhere using your ward name and password. If you are unsure how to use these details, please ask your ward manager. Using the tablet on a cart, access the patient and relative communication waiting area via www.bfwh.nhs.uk, and when prompted, enter the patient's name and date of birth. Now do your checks. Is the patient comfortable and personal care has been given? Is the patient ready for the phone call? In the Attend Anywhere waiting area, do the details of the patient and loved ones match? On the ward PC, join the call with the loved ones. It's now time to do some final checks. Are they the correct loved ones? Do you need another contact? When you've done all your checks, you can add the patient to the call. You will now be connected to the relatives and the patient's tablet, so the ward PC needs to leave the call. On the ward PC, select End button and then leave the call. This means that the patient's tablet and the relative are connected together. You can now take the tablet to the patient. When the time is right, you can end the call for everyone. And that's it. Thank you for your time and stay safe.